Hello, my fellow Americans, and welcome back to the American Patriots channel. Today, we're going to be talking about health care. At this very moment, there are almost 100 million Americans that lack adequate health care insurance. They are either uninsured or they are underinsured, and yet access to quality health care is a basic human right. It says so right in Article 25 of the United Nations Universal Declaration of Human Rights. Let's take a look at what it says. Everyone has the right to a standard of living adequate to the health and well-being of himself and of his family, including food, clothing, housing, and medical care. What this means is that everyone should have access to food, clothing, housing, and medical care, either by way of their own means or, if they're of low income, with some help from the government. Our goal today is to ensure that everyone in America has access to high-quality health care, and we will do this by utilizing health care insurance. Let's dig in and find out how we can provide this basic human right to all Americans. Now, our legislators have been working on this problem, as you've probably noticed, for many years, and they've come up with a variety of solutions. And yet, every time they come up with an answer, it seems to fall short in one area or another. Well, it turns out that in order to have effective health care, it needs to meet 4 criteria. It needs to be universal, meaning that it covers everyone. It needs to be comprehensive, meaning that it covers everything, that it doesn't have gaps in coverage. Otherwise, it's not worth very much. It needs to be affordable. Oh yeah, here's the one that's very difficult because healthcare, as you've noticed, is very expensive. So the plan needs to be affordable not only to the individual who is receiving the health care, but also to the taxpayer too. And finally, it needs to involve high-quality health care. Now, these legislators, when they come up with their plans too, oftentimes they don't give specifics. And if they did, we could dig down and look into the details, and we could find out that, sure enough, one or more of those 4 criteria are not met. It's like a chair with 4 legs. If at least one or more of the legs is missing, the chair falls over. Doesn't work. All right, so here's the thing. I've been spending a lot of time analyzing this problem and running tremendous number of calculations of incomes and subsidies and so on and so forth, and I have come up with a solution to our health care problem. I have come up with health care that will cover everyone in the entire country. Health care that is comprehensive, will cover all medical needs. Health care that is affordable to each and every one of us and affordable to our government and us, the taxpayers. And health care that is of high quality. Now, how did I do this? Well, I've got a lot of experience at doing exactly this kind of thing, which is trying to solve highly technical problems. I have a master's degree in chemistry, and I've spent about 30 years working in a nuclear power plant as a power plant chemist. And my job was to solve highly technical problems. So I've brought all my skills to bear on this problem, and I'd like to share with you what I've come up with. Now, the first issue that we need to address is cost. I can tell you right now that healthcare costs in America are astronomically high. You probably know that already. And unless we work to reduce those costs, then there is no effective health care that we can obtain in our country. There is none that will meet those 4 requirements. We must reduce the cost. So if we don't reduce the cost, might as well turn the video off right now, and I might as well quit talking. All right, so let's tackle that problem first. Let's look at the cost of health care in America compared with other countries. This graphic illustrates what wealthy countries are spending per person on health care. And as you can see, as of 2019, the United States is spending for every man, woman, and child in the entire country about $11,000. And this is far more than these other countries who spend on average about $5,700. So we're spending about twice as much as the average wealthy country. What I propose is that we reduce our healthcare costs by 40%. Now, if we do so, that'll put us about where Germany is, around $6,600, $6,700 per person. If we do so, though, that would cause a shock to the healthcare system if we all of a sudden reduce costs by 40%. So I propose a work-down curve where we reduce costs by 8% per year for 5 years. And at the end of those 5 years, we will have reduced costs by 40%. Well, how do we reduce the cost of healthcare by 40%? As it turns out, Medicare is the ultimate cost control tool. Let me show you what I mean by that. This graphic shows what the cost of a variety of medical services incurred by private insurance is versus Medicare. The Medicare payment rate is set at 100%, and then whatever private insurance is shown in the graphic. So let's start with the second one from the left, the inpatient hospital services. Private insurance is paying anywhere from 151% to 222% of what Medicare pays for those same inpatient hospital services, with an average of 189%. What that means is that private insurance is paying almost twice as much as Medicare. Now, if we move one over to the right, the outpatient hospital services, private insurance is paying on average 264% of what Medicare pays, a little over 2.5 times as much for the same services. And then finally, on the far right, the physician services, private insurance is paying 143% of what Medicare pays. What this clearly shows is that Medicare is far more effective at controlling costs than private insurance. Medicare controls the cost of healthcare services by regulation and by negotiation with the providers. Now, the providers and the insurance companies will not like this change because they would stand to lose revenue. And what they would do in order to convince you that this is a bad idea is they will use scare tactics. And they'll come up with 2 reasons that this is no good for the American public. One is that this is socialized medicine, and the other is that the quality of the health care that we receive will be reduced. Well, let me address both of those right now. Socialism and socialized medicine would mean that the government is taking over ownership of all of the above. They would own the insurance and they would own the providers. That's absolutely not the case, because the insurance companies would still be free to offer insurance to anyone who wants it, and the providers would continue to be privately owned. And not only that, the providers could opt out of the cost structure that Medicare establishes. In fact, that's what's happening today as well. Providers do not have to accept Medicare cost structures. They can opt out. So there's no difference in what's going on right now. Not only that, but this is still capitalism because this is a capitalist country. But remember one thing about capitalism, we do have to have some rules to go by too. It's not the wild, wild west out there where everybody can take advantage of the other. And an example would be antitrust laws. Antitrust laws say that companies cannot get so big that they can dominate a section of the market and eliminate the competitors. That's not good for the public. Well, in terms of healthcare, we are in a healthcare crisis. The fact that almost 100 million Americans do not have access to affordable healthcare coverage means that we need government intervention to step in and fix the problem. Now, that intervention needs to be thoughtful and measured so that it doesn't disrupt the capitalist free market system. And what we need to do is, as I proposed here, which is to utilize Medicare to effectively just reduce those costs down to a more sensible level, a level that the other wealthy countries in the world are paying also. And then let me address the concern about whether the quality of the health care would be reduced. They'll say, oh, you get what you pay for, and all these other countries have lower quality health care. Well, let me dispel that rumor right now. Check out the title of this graphic, which says, although the United States spends more on health care than other developed countries, and what we saw, we spend way more than other developed countries, its health outcomes are generally not any better. And look at the measures that are provided here. In terms of health status, life expectancy at birth, well, we're below average. The worst is on the left, and the best is on the right. Infant mortality. You would think in a modern country like the United States we could keep our newborns alive at least, and yet we're well below average compared with the rest of the world. And what about the quality of primary care? When it comes to asthma care, we're about average, and diabetes, we're below average. Well, how about the quality of acute care, such as safety during childbirth? You would think that we could protect our birth mothers at least, and yet we are well below average. And then finally, the heart attack mortality, well, there we're somewhat above average. I have read a variety of studies comparing the quality of health care in the United States with the quality in other countries. I've linked many of those studies down in the comments section, so if you want to read them yourself, you can. Now, what those studies do is they use a variety of measures to illustrate quality of health care, and even though they measure it differently, they all come up with essentially the same conclusion. And that is that the United States has good quality health care, but there are several countries that have better quality health care than we do. So what this clearly demonstrates is that we can have high quality health care in America and yet pay much less, just like those other countries. All right, so if we're going to use Medicare then to help us control healthcare costs, let's take a look at Medicare and see exactly what it is. So this shows what traditional Medicare is, the Medicare that exists today. And as you know, it's available to those 65 and older, and those people still pay a premium, a monthly premium, for that healthcare coverage, but much of the premium is paid for by payroll taxes. Traditional Medicare has two parts, two basic parts, Part A and Part B. Part A covers inpatient services, that's when you're in the hospital, and Part B covers outpatient services such as doctor's office visits. Part A has a deductible of $1,484, so a patient would pay that before Medicare pays anything, and then for Part B it's $203. Once a patient has paid their deductible, then Medicare pays 80% of the rest, and the patient pays 20%. The problem with Medicare is that the out-of-pocket limit is, well, there is none. So if you had, let's say, $100,000 of expenses, you'd be looking at paying roughly 20% of that. In other words, about $20,000. And then, as I said, there's a monthly premium. Now, Part A has no premium for retirees, and Part B has a premium that is based on income. And there too, traditional Medicare has a number of gaps in coverage. It does not cover prescription drugs. It does not cover routine dental, eye, or hearing care, nor does it cover long-term care. So we've established that we need Medicare to help us to control healthcare costs. But when we look at Medicare coverage, there's some major gaps there. We need comprehensive coverage, and yet there's a lot of things that Medicare doesn't cover, like dental and vision care, long-term care, and so on. Not only that, but the out-of-pocket costs are unlimited. That's not affordable. That 20% copayment could become astronomical if you have a big hospital bill. So what we need is some sort of a beefed up Medicare. Well, ladies and gentlemen, I got some good news because I'd like to right now introduce the new Medicare. Comparing the new Medicare with traditional Medicare is like comparing Arnold Schwarzenegger to an infant. New Medicare rocks. New Medicare has 5 parts, and it is comprehensive. New Medicare is a bumper-to-bumper coverage, and in this case, head to toe, it covers it all. It still has Parts A and B like traditional Medicare, covering in and outpatient services, but it also has Part D, prescription drugs, Part E, dental, eye, and hearing, and Part F, long-term care. Now, as far as deductibles, they're the same as traditional Medicare for Parts A and B, $1,484 and $203. Part D has a $400 deductible, Part E $100, and Part F $0. The copayment across the board is 20% on all of those parts, except for Part D, where it's 20% for generic drugs and up to 50% for name brand drugs. Now, in terms of affordability, there is an out-of-pocket limit, and it is based on income. And in a few moments, we'll get to see some specific examples so that you can see exactly what that is. And then also, it has a monthly premium. The premium is based on income. And then also, if a person is employed, usually their employer pays for the premium. And then finally, for retirees, they would get assistance paying their premiums through Medicare payroll taxes. And notice, new Medicare is different than traditional Medicare in that retiree Medicare starts at age 60, not age 65. New Medicare would be available to all ages and would be the same coverage for everyone. The only difference is those age 60 and older would get additional help paying their premiums through Medicare payroll taxes. Now, new Medicare would also cover preventative care at no cost whatsoever. Things such as medical exams, screening tests such as blood tests, mammograms, and so on, dental exams including cleanings and x-rays, hearing exams, and eye exams. All of those would be covered at no cost. And finally, new Medicare would have protections for those with pre-existing conditions. They would pay no more than anyone else, and they would not be excluded from coverage. All right, so now that we've seen what new Medicare covers, let's look a little bit further into the subsidies. Those subsidies would help many of us pay for not only the insurance premiums, but also the out-of-pocket expenses as well. And those subsidies are based on income level. I've given 3 examples here, one for a single person, one for a married couple, and one for a family of 4. So let's take a further look at the single person example. If that person makes up to, but not including, $17,775, they would be eligible for Medicaid. Now, taking a note at what it says at the bottom, right now Medicaid would not be available to all people in all states. Right now, 12 of the states do not provide Medicaid for those of low income unless they meet special requirements, such as if they are disabled. Under new Medicare, Medicaid would be expanded in all 50 states, and everyone under the income threshold would receive Medicaid. And then moving a little over to the right, if a person made exactly $17,775, they would convert over to the new Medicare coverage, and they would receive a full subsidy. Now, what's a full subsidy? What that means is the subsidy would cover not only their insurance premiums, but also any and all out-of-pocket expenses that they may have. So in effect, a full subsidy is a free ride and will cost them nothing. Now that subsidy would gradually decrease, though, as income level increased from that point, and when it reached $171,000, the single person would no longer receive a subsidy, but instead would be responsible for paying both their premium in full as well as their out-of-pocket expenses. Now, the other two examples, the levels are just a little bit higher. Like, for example, the married couple, the subsidy expires at $341,000, and for a family of four at $443,000. Now that we've looked at the new Medicare coverages as well as the subsidies in general, let's take a look at some specific examples so that you can see exactly how new Medicare functions. In our first example, we have a family of four earning $150,000 per year, and they are self-insured. What this means is that they do not get help from an employer in paying their insurance premium. They have a variety of health care expenses, including a knee replacement surgery at a little over $28,000, 10 doctor visits at $1,550, 18 physical therapy sessions for the knee replacement at $2,250, 3 prescriptions at $1,443, 3 cavities filled at $300, and a dental crown at $1,250. For this family, their total out-of-pocket cost for all of those expenses would be $2,779, and their insurance premium would be $505 per month per adult and $148 per month per child. In our second example, we have a retired married couple with $80,000 of income per year, and the husband is confined to a long-term care facility costing $99,460. And yes, long-term care is very expensive, and this is just the average of what it might cost. For this couple, the out-of-pocket cost would be the full $99,460 under traditional Medicare, because long-term care is not covered under that insurance. However, new Medicare would cover most of it, and they would only owe $6,543 of the total. The insurance premium for traditional Medicare would be $148.50 per month per person. Under new Medicare, it would be $250 per month. That's quite a deal, considering that it's only about $100 extra per month, and yet covers a lot more than traditional Medicare. In our third example, we have a single person earning $70,000 per year, and that person has employer-sponsored health care coverage. Under new Medicare, the maximum out-of-pocket for that person would be $2,861. So no matter what kind of expenses they incurred during the year, that is the most that they would have to pay. And then their insurance premium would be zero because their employer is picking up that expense for them. In our fourth example, we have a single parent with 3 children earning $37,000 per year, and they do not have employer-sponsored health care coverage. Under new Medicare, their total out-of-pocket expense for the family would be zero. They would receive a full subsidy. And in addition, that full subsidy would cover their insurance premium, so they would pay nothing for that as well. For our fifth and final example, we have a family of 4 earning $850,000 per year, and they are self-insured. So they would receive no subsidy to help them pay for their premium or out-of-pocket expenses. Under new Medicare, the maximum out-of-pocket limit would be $7,000, and their insurance premium would be $1,272 per month per adult and $374 per month per child. Okay, what we have just outlined is a wonderful health care program for all Americans, one that is universal and covers everyone, one that is comprehensive and covers everything, one that is affordable to you and I as recipients, and also affordable to our government and our taxpayers. And finally, one that is of high quality. So with such a great program as this, why haven't we done this already? Well, as I've mentioned, there are those that don't want this, and it makes perfect sense. The healthcare providers and the insurance companies would lose revenue if we did this. And the way it works is those groups will tend to try to persuade our politicians not to go ahead and do this. And as I mentioned too, they'll use scare tactics to try to get us to think that this is a bad idea, that this is socialized medicine and the quality of healthcare will decrease significantly. All untrue. And then what they will do too is they will make significant campaign contributions to our politicians to try to help get them to see it their way. And they'll also hire lobbyists in order to get their ear and catch their attention. So in a way, this is kind of a form of corruption. It's harming the American people by withholding a basic human right. My fellow Americans, there are almost 100 million of us that have been deprived of the affordable health care that we need. Health care that is a basic human right. Today is the 4th of July, and once again we find ourselves struggling to gain what is rightfully ours. We need to fight against corporations who value profit over our own health and well-being. So from this day forward, we must not rest until all of us have affordable health care. All right, well, that concludes the discussion on health care in America today. My only hope is that we can convince our representatives to enact such a program, because if they do, it will benefit all Americans and will make America a shining star to the rest of the world. Now, next episode, I'm going to talk about a very challenging topic, and that is race relations. I'm sure you've probably noticed that America is having some problems in that area. And unfortunately, there have been some misguided efforts that have actually made things worse. So next time we're going to cut through all the misinformation and the misguided efforts, and we are going to lay out a plan to restore our nation with regard to race relations. Please tune in. I know that it will be beneficial. Well, until next time, God bless you all. I'll see you then.